So, as Kathy mentioned, our our discussion is going to be on when we cannot cure. So, thoughts on the ultimate challenge to the bond of the patient and doctor. And we incorporated a lot of what we had interpreted of Dr. Berman's presentation, where we learned a lot and got a really invaluable perspective from him. And I also just wanted to say thank you to Kathy really quickly for really helping us guide the conversation. So first, we started out by talking about some of the key points that we thought were really vital to the patient-doctor relationship. And sort of our overarching takeaway from that was that it's important to relate to the patient outside of the walls of medicine. And this can include a lot of different things, including non-medicinal methods of healing. So, social and emotional care are just as important. And it's important that we balance those three facets of providing care to a patient, and then also maintaining the dignity of the patient. So recognizing that they are more than just the case that is presented on a file, more than just their diagnosis, but they're a person with emotions and hopes and pain and all of those things, and we need to respect their dignity. And then some of the keywords that we came up with to describe the patient-doctor relationship were trust, honesty, empathy, and respect for the patient. And also just having a holistic approach. So really looking at not only the patient, but also their case from a very overarching point of view, recognizing that not only are there multiple points of care and methods of care, but there's also multiple complexities to the patient, and not trying to oversimplify that. And then another really interesting point that was brought up was the idea of cultural competency. So recognizing that patients are going to come from different backgrounds, different nationalities, cultures, races. And so it's important as a healthcare provider or someone working in the field to try to understand the patient's cultural background, whatever that might be, because that can really influence what kind of care they might need and what that might look like. But also, balancing that with cultural humility, because having not lived through their culture and their experience and their life, we can't fully understand everything about their personality and who they are. So it's important to recognize that while still trying to do everything we can to understand the patient. And then one approach is not going to work for every patient. They're all different people, and it's important to try to personalize care as much as possible, which can be difficult considering a doctor or a nurse or someone who's working in that field does see a lot of patients in a short amount of time, and it can be hard to really connect with them and provide very specialized care, but it's important to do as much as you can in that regard. And then some doctors prescribe medication as a quick solution rather than really connecting to the patient and having conversation with them and understanding who they are. And that, as I just mentioned, is a result of time constraints, which is an important concern within the field, because there is a large amount of workload in something like the medical field, but as much as possible, it's really important to try to go beyond just prescribing something or diagnosing something. So that brings the question of, for future healthcare providers, how will we improve? And just to add in a little bit of my own perspective as someone who really does want to go into the medical field as a doctor, as a surgeon, I think it's really important to always have this question in mind. It's our job as someone who's providing this kind of care to someone who may be in some of the most vulnerable moments of their life. We constantly have to be thinking about how we can provide the best care possible for a patient. And one thing that we discussed briefly that I thought was really interesting was, as someone who has doctors in my family or relationships with doctors, I've often heard them say that as they go throughout the process of training and going through medical school, they often try to limit the relationships from the patient, whether that's to be more efficient because of the time constraints, or also to respect their mental needs, because it can be very emotionally taxing to be in a position where you're seeing so many graphic and vulnerable and difficult things. But I do think it's important to try to go beyond that and remember that our patients are human. So to not dehumanize them, but to rather give them the dignity and respect they deserve. And then just for more consideration, some things that we thought add a little bit of complexity to this that we might want to have further conversation on or think about more are balancing productivity and time management while also building a relationship with the patient. It can be really difficult to do that. Also, the role of the healthcare provider when addressing difficult situations with the patient's family. So, how close should they get to the family and the patient, especially in such hard moments? And, that's also not only is that difficult for the family, but that's also difficult for the doctor or whoever the healthcare provider is. And that can add a lot of grief and trauma on their side. So how might they work through that? Um, and adding on to that, there can be even more vulnerable moments, such as wars and pandemics, where doctors, have to go through some of the most pressing moments of their life, but also continue to provide care because it's a moment where there's so many people in need. And they also may have people in need in their own lives, whether it's family members or friends. So, how do you balance that? And then another thing we discussed was the impact of telemedicine on the patient doctor relationship. This kind of connects to other groups' presentation, but in a new age of AI and technology really coming into the scene, especially in medicine, how might these kinds of practices impact the relationship between a patient and a doctor? And so we talked a little bit about how it can kind of detract from the holistic approach that we were trying to aim for, in that, it can be very easy to just see the person on the screen and not look at all of them, but just, give them a diagnosis and be done with it. So really trying to go beyond the technology, to really, form a human to human relationship with your patient, as best as possible. Yeah. And now I'm going to hand it over to Celeste.
So next, we looked at the situation from the perspective of the healthcare provider. And so as we sort of established how it's so important for doctors to get to know their patients so they can better help them, and especially in end of life care, when it's not necessarily like a fixable solution. We have to also look at the impact of that on the healthcare provider, especially when they're around a lot of terminally ill patients. That impact on their mental health and well-being can't really be neglected because they're people too here. And so we were looking at maybe some possible solutions for that. One of them could be relief provided by the healthcare institution, such as some sort of therapy, which could help them sort of process these emotions and these connections. And then also, it's also important to have a balance between the emotional involvement with patients and sort of setting up these personal boundaries, even though, as we've said, it's so important to develop these connections. Sometimes it can go too far, and it's okay for healthcare providers to set boundaries with their patients for both the mental health of the patient and the healthcare provider. It works both ways. And again, we have to ask this question: how intimate should the relationship between the medical provider and the patient be? Like, where do we draw the line for how close is too close, how involved is too involved? And so there's not going to be one overall definitive answer. A lot of bioethics, I feel like, is really looking case to case and trying to assess the situation more holistically, instead of just creating this overarching, kind of distant, rule. And so this sort of brought us to our conclusion, I guess, which is, again, a bit oversimplified. But our main takeaway here is how we have to acknowledge the humanity and vulnerability of both the healthcare provider and the patient. Sometimes when you're looking at just one or the other, it's really easy to think of the patient or the healthcare provider as just sort of like a term, not really acknowledging their status as a human being who is going to feel a lot of different emotions in these really intense situations when they're both really vulnerable. And so I think the first step to helping out with these problems is to acknowledge our humanity and vulnerability. Thank you.
Thank you. And this is why we now have confidence in the future if the future of our healthcare providers are what was just presented, we can all take a deep breath onto that. Thank you all. The group did a very good job at discussing the topics and bringing up the various aspects of how this particular topic and presentation is impacting the daily lives on a theoretical, philosophical, and practical level, and how it actually touches on to all the other topics. So thank you to the group. Good job, guys.